Mpox, formerly known as monkeypox, is a rare disease caused by the Mpox virus. This virus usually affects rodents such as rats, mice, or non-human primates such as monkeys. However, it can also infect humans. Prior to 2022, human cases of Mpox were only detected in parts of Central and West Africa where the virus spread through the contact of infected wild animals. In early 2022, an outbreak of Mpox began in Europe and quickly spread worldwide, including USA and Canada. Most infections occurred as a result of direct and prolonged close contact with an infected person via intimate or sexual contact. Mpox symptoms may start 3 to 17 days after a person is exposed. The time between when you're exposed and when you have symptoms is called the incubation period. Symptoms last 2 to 4 weeks and may include fever, skin rash, swollen lymph nodes, headache, muscle ache, backache, chills, and tiredness. About 1 to 4 days after you begin having a fever, a skin rash starts. The Mpox rash often first appears on the face, hands, or feet and then spreads to other parts of the body. But in cases linked to the outbreak that started in 2022, the rash often started in the genital area, mouth, or throat. The Mpox rash goes through many stages. First, flat spots turn into blisters, then blisters fill with pus, scab over, and fall off over a period of 2 to 4 weeks. When your symptoms start until your rash and scabs heal, you can spread the virus. See your healthcare professional right away if you have a new rash or any symptoms, even if you don't know anyone with Mpox. The virus spreads through close contact with an infected animal or person, or it can spread when a person handles materials such as blankets that have been in contact with someone who has Mpox. The Mpox virus spreads from person to person through direct contact with rashes, scabs, or bodily fluids of a person with Mpox, extended close contact, more than 4 hours, with respiratory droplets from an infected person. This includes sexual contact. Clothes, sheets, and blankets or other materials that have been in contact with rashes or bodily fluids of an infected person. An infected pregnant person can spread the Mpox virus to a fetus. Mpox spreads from animal to person through animal bites or scratches from an infected animal, wild game that is cooked for food, products such as skins or furs made of infected animals, direct contact with fluids or rashes of an animal with Mpox. To diagnose Mpox, a sample will be collected by swabbing your skin or mouth lesions and surrounding skin because lesion material is the best sample type and most likely to give an accurate test result. Then, they send it to a lab for a nucleic acid amplification test, or NAAT, which is a molecular diagnostic test. You may also need to give a blood sample to check for the Mpox virus or antibodies your immune system makes. Treatment for most people with Mpox is aimed at relieving symptoms. Care may include managing skin damage from the Mpox rash, drinking enough liquids to keep stool soft, and pain management. If you have Mpox, isolate at home in a separate room from family and pets until your rash and scabs heal. There is currently no specific treatment approved for Mpox. Healthcare professionals may treat Mpox with some antiviral drugs that have been used in smallpox treatment. Fight Mpox with Norgen Biotek. Norgen is always ready to assist you every step of the way in the fight against Mpox, offering a range of options to meet your needs for accurate diagnosis and research.